Good evening, everyone. Sorry, good morning for many of you out there around the world. I hope you all are doing good. This is a live session that we are doing after a very, very long time, and in fact, it's gonna be the first time in 2022. Well, so happy New Year, everybody, and I hope you all are having a great New Year, and I wish you all the best. So today is double special day. That is, first we are doing the first live session in the year 2022 with a neurologist and MS specialist, and I will be introducing her here very soon. And the second reason is thank you everybody for all your support, as today we have got 20,000 supporters on our page, and this is with all your love and support that we have come to this milestone, and our community has become so strong. So thank you everyone, and without wasting any further time, I'm gonna add and ask my guest of the day to come here. Her name is Rhaisa Castrodad Molina, and she is a neurologist and an MS specialist who's gonna come here and help us more about MS and ask, and you can ask the questions that you want to her. I'm really excited to have her here. Hi.
Hi, how are you?
Good afternoon. How are you?
I'm doing great. I'm very excited to be here with you and be sharing with other patients of MS around the world. So, really thankful for the opportunity, and I'm very excited to start sharing information regarding the disease and creating more awareness.
Thank you so much, and we were very excited to see your profile.
Thank you.
You're a neurologist and you're MS specialist, and you're new on Instagram.
Yeah, that's true.
And like I said, today we have got 20,000 people strong, and that's how we want to support everybody. Then we saw your profile, we said yes, we have to support each other.
That's
So everybody watching us here today live here, go and follow Dr. Morina on her page. She's new on Instagram, but she's an MS specialist and she can help and guide you in many ways. Thank you so much once again, Doctor, to be here. Thank you so much.
Thank you so much.
So, Doctor, I would like to first ask you that why MS specialist? What made you, have so much interest in MS specifically?
So I'm from Puerto Rico. So I currently work in Puerto Rico, and during my residency, I wasn't sure what I wanted to specialize on. But as soon as I started doing clinics and doing my rotations during the hospital, I started seeing how many patients we were having and how many had a delayed diagnosis or were not being managed as they should. So I'm sorry. I saw the big necessity we had here in the country. We only have, I think it's 3 MS specialists, and they're pretty overwhelmed with patients.
Wow.
So there's a very high demand. Today I was talking with several friends here in the hospital. I'm in my car, sorry, just to get out of the loud noises. But right now I was talking with the administrative secretary. She has a family member that has MS. The pharmacy director, her mother has MS.
Oh my
I
God.
was talking with a physical therapy manager, and her sister has MS. So it's pretty overwhelming here, and not only MS, but other demyelinating diseases like
Yeah.
NMO, MOGAD. Right now I have a transverse myelitis that she wasn't diagnosed, and she has been like 5 years unable to walk, but
Oh
nobody
my
has
God.
spinal MRI. So there's a big need of more MS specialists here in the island. I don't know why there's such a big incidence of the disease in here, but I hope we can figure it out someday. But yeah, I think that that's what drew me, and seeing all the exciting stuff that's going on with the treatments and how well patients are responding. And I got in love as well with the MS community, how all of you look up to each other. So all those reasons got
Thank
me
you
in
so
love
much.
with
It's so
us.
lovely. I can just say that it's just your kindness that people who think about, like you, about the other people to help the other people, like MS community is, that's where, we want to be supported and helped by people who can understand us.
Yeah,
Well, I also have to say, like you said, so many people around you have MS or
yeah,
know someone who have MS. Don't
yeah,
you think that earlier MS was called as a rare disease? It
yeah,
was a rich world's disease, and
yeah,
now like everyone is having it. So, and
yeah,
it's as if the awareness has literally gone from here to here, and that's
yeah.
why more and more diagnosis is being happening. More people are getting aware about what's happening to them or to the relative and getting the necessary test done.
Yeah, definitely. I think that you guys and us as doctors, as we keep creating awareness in regards to the disease, not only to patients to get their symptoms checked out, but also the medical community to look more ahead. If you have very mild symptoms, to think outside the box and think how common this disease is, and do the appropriate testings and evaluations to rule out the diagnosis.
That's right. Absolutely. Thank you, doctor. So I can see a number of questions already started coming up from the audience here. So as we talk, we'll keep taking some of the questions from the audience. So
Yeah,
the first question I can see here is from Russell News, and he's written, Doctor, can you tell us about some early signs of MS relapse? And also I have another question which was DM'd to me by the other patient who has asked that how do we differentiate between a major MS symptom and MS relapse?
yeah. So I'm gonna start with that last one. I think it's more concrete. But usually an MS relapse, not usually, but it is defined as a focal neurological deficit that we are gonna define pretty soon. But that lasts more than 24 hours. That's what's a relapse, because we can have pseudo relapses. And
Right.
pseudo relapses are symptoms that you had before, and because of lack of sleep, dehydration, heat exposure, anxiety, stress, underlying infections, they can recur. So those areas that are scarred, they can reemerge those symptoms you had before. And usually by treating the causative agent, we can decrease the symptoms and they can resolve eventually. That's why
Okay.
it's important to avoid triggers like heat exposure. If you have to work under the sun, then you can wear a cooling vest, avoid
Yes.
high exposures, doing exercise maybe in the pool or areas which are not as hot as being exposed to the sun or running at 12 p.m. in the day. Um, so managing those stressors can prevent having pseudo relapses. But if
Right.
you have a new symptom, a symptom you didn't have before, and that lasts more than 24 hours,
Right.
then you have to have that checked up because it can be a new lesion that's going on or evidence of active disease. And then you might need to get acute treatment with steroids and maybe discuss changing therapies if you are already in one.
All right.
Um, but in terms of symptoms, all patients are different, and there's not such thing as mild or severe or early symptoms for MS. They can vary immensely because it will depend on where are the lesions located. You can have vision loss because of optic neuritis. That can cause pain when moving the eye. Acute vision loss, having trouble to see colors,
Mm-hmm.
Also, you can have lots of sensation in one arm, one leg, the face, all of them at the same time, depending on where it is located. Weakness in the face, arms or legs. Also, uh, you can have problems coordinating your arms or instability when you're walking, that your speaking changes, it becomes more slurred or dysarthric. Also, double vision can be a symptom.
Yeah.
Uh, also, problems with fecal or urinary incontinence can
Yes.
also symptoms which can be mild or can be pretty severe where you're completely incontinent or you start noticing like maybe weakness in both legs and I'm becoming more constipated than usual. So yeah, it's a really wide spectrum of symptoms, but it will depend on, uh, again, everybody is different, and
They're
it will
different.
depend on where is the lesions located, how many lesions do you have, and whether it's a relapsing remitting disease or a progressive disease, because maybe your symptoms is that you started with progressive difficulty walking since onset and you've been
Mm.
years like that and you don't have like a clear relapse of one-sided weakness. It's just the
Mm.
walk. That can be a symptom of MS as well. And that's one of the most common presentations of the primary progressive forms of the disease.
Yes.
I think the any focal neurological problem must be evaluated.
Absolutely.
Mhm.
I can remember the worst symptoms that I had was one was Lermit sign, which was an electric
That
current all
that's
over your body. I just hated it.
yeah,
I just get goosebumps every time I think about it.
yeah.
It was horrible.
I
And
have,
other thing
but
was,
I yeah. No,
and
I'm
the
sorry. Sorry.
sorry.
You can go on. I'm so
Yeah.
sorry.
And the other thing was about the sensitivity. So even a strand of hair, if it would touch my skin, I would scream out in pain.
Yeah,
It was really bad.
yeah,
Yeah.
yeah.
So
Lermite sign is a very common sign actually. If you have lesions in your cervical cord, that can cause a current-like sensation going down your spine, and that's what you're
yes.
defining. Mm-hmm.
At this point, I also would like to say that I believe there are many other neurological disorders which can have similar symptoms like of MS.
Yeah.
So I've had people writing to me that they have certain symptoms and they have not gone to the doctor because they are scared of going to the doctor because doctor might say that they have MS. So
Yeah.
they're sitting at home and just getting worried and feeling anxious. This is my advice to those
Yeah.
people. There are several conditions and several, not, it doesn't have to be like bigger things like MS, can be something little less, small, lesser problematic as well, which, can, or maybe you did not have right good amount of sleep or did not eat good or such, or must have had too much of heat exposure, because of which also you might have some symptoms and you might think it's MS. So
Yeah.
don't jump
That's
to
very
conclusions.
true. Yeah. So it's I think that the key slogan or mantra for MS is that for those of you that are thinking or scared of going to the doctor upon having a neurological problem or symptom, is that in MS and the majority of these diseases, I know it's hard to swallow the pill that you may have autoimmune neurological problem, but time is key. uh,
Absolutely.
uh, Treating MS early doesn't only prevent having further relapses and a disabling neurological deficit, but also initiating treatment earlier can prevent. I'm sorry.
Yeah.
So treating the disease earlier can prevent having or converting to a secondary progressive form of the disease, or it can delay it more. So time is key. Don't think about it. Just take action, because delaying the diagnosis is just gonna make everything worse. Um,
Absolutely.
but yeah, there are multiple. When we have somebody that has suspicion of MS, we shouldn't confirm the diagnosis before um, or prior to confirming or doing blood work to rule out other rheumatologic disorders or other what we call MS mimickers like lupus, rheumatoid arthritis, Sjogren's, sarcoidosis, NMO, which is pretty novel diagnosis, MOGAD, all of them can look pretty similar. And the thing is that, especially between MS and NMO and MOGAD, their treatments are different. And MS treatments can sometimes make NMO and MOGAD patients worse. So um, all this, they should be evaluated and ruled out before establishing a specific diagnosis.
Yes, thank you, doctor. That was very good advice. So, I have another question by Himanshi Chaudhary, and she has written, "I have MS and I want to be a pilot. Is it possible to clear medical of my course with this condition?"
I'm sorry, can you repeat the question again?
She wants to be a pilot, and she is not sure if the medical examination can be cleared if she has MS.
Uh, I can
She
understand. I'm looking for the question just to
uh, no,
be
no,
able.
she wants to be a pilot,
Oh,
and
a pilot.
she is in
Okay, I'm
MS
sorry.
stop her from pursuing her career.
Okay, I'm so sorry.
It's okay.
Yeah, I think that MS patients shouldn't change their goals or lifestyle because of the diagnosis. Um, of course, you have to do several modifications, specifically with the stress, heat exposure. But MS shouldn't stop you from your goals as long as they are not threatening to you based on your disabilities. I mean, if you're fully functional, if you can see well and you don't have any coordination problems, and you pass your medical exam to become a pilot, just go ahead. Definitely, the diagnosis shouldn't stop anybody from looking towards their goals if they're able to do so with their disabilities.
Absolutely. It's just that MS can't stop you.
Yeah,
But you,
definitely.
yeah,
A
you
patient
can
once
help.
told me, and I always say to everyone, and is that I have MS, but MS doesn't have me. So that mentality can change your everything, and your attitude towards life and your goals and everything that you propose to.
Thank you, doctor. It's such a positive session. Thank you so much for your advice. So I can see another question by Needs 12, and he's written, "Have you heard of electrical treatment for foot drop?"
Yeah, actually, there are devices that they stimulate your nerve, and they can help you with the foot drop while walking. Some of the problems with them is that sometimes insurance don't cover these equipments, but if you're able to cope with cost, they're pretty beneficial. They can help a patient so much in their walking. But yeah, specific electric currents to the nerve, no, but I know about devices that can help with the foot drop and help with the walking in the patients. Yeah.
Okay, okay. Thank you. Um, we have a question by Rhaisa Maniau. She has written, "Are you familiar with treating MS through diet and lifestyle rather than medical treatment?" Yes, so we are seeing so many people opting not to take DMTs or other medical treatment, but they just want to treat them with lifestyle methods like proper diet, proper sleep, and proper exercises. So, what is your take on this? What is your opinion about it?
Yeah, I once had a patient that at my clinics that decided to go for diet and lifestyle changes. Her MS was super mild. She barely had any lesions and she was doing well. But
Okay.
um, every case is different, and cases where the lesion burden is more severe, and even if it's mild, studies show that the natural history of the disease without disease modifying treatments is to eventually transform into a progressive form. So that's our goal with the disease modifying therapies: prevent or delay that. We cannot reassure, we don't have any evidence that through only diet and healthy lifestyle, we can prevent that from happening.
Okay.
Um, but they should all go by hand. A healthy lifestyle, having an active, doing exercise regularly has been found to be as important as the treatment.
Right.
Um, it can prevent or delay cognitive symptoms, can prevent from developing spasticity. It can prevent you from start getting muscle wasting. So it should all go by hand. Right now, there's no scientific evidence that shows that any specific diet is particularly beneficial to MS. Recently, they published a paper that the Mediterranean diet might be particularly better than others, but
Mm-hmm.
what we recommend is just to eat your vegetables and eat as healthy as you can, avoiding any anti or pro-inflammatory foods like meal sugars, refined
Right.
carbs, high fat diet. All those modifications, you can do them to create a less inflammatory environment in your body.
Right. Right. So, doctor, what is your opinion about gluten and for milk? You have already said, but what about gluten? Do you think you are pro gluten or anti gluten when it comes to MS?
If you have celiac disease and you don't tolerate gluten, then you should remove it from your diet. If you find it beneficial to not take gluten, then go ahead and do it for yourself. But again, there's no evidence that as a doctor, I cannot use the current data to recommend a gluten-free diet for MS.
Okay.
But I do can recommend a healthy diet, and I do have data to say that it is really beneficial for MS patients to carry
Right.
on a healthy lifestyle.
So avoiding certain things and bringing a proper change in your eating habits can actually reduce inflammation.
Yeah, definitely. There's more and more data coming about metabolic disease, obesity, hypertension,
Yes.
coronary artery disease, and these patients tend to do worse than patients that have a healthy weight and don't have as many comorbidities as
Yes.
those with other medical problems. So, data does show that having a healthy weight, not suffering from metabolic disorders, does
Mhm.
show uh, that these patients have less disability than those that do have those disorders. So we base on that to recommend patients to carry on with a healthy lifestyle and weight and all those stuff.
Thank you. So there's a question by Russell News here, and he has written, Doctor, does MS affect the sense of smell? After recovering from COVID, I have been experiencing pungent smell from almost everything. Do you think it is COVID related or MS related?
definitely COVID related. The smell is through the olfactory nerve, and to my knowledge, it doesn't tend to be affected by multiple sclerosis.
Okay.
So I would
Okay.
find towards COVID related.
So, what is your take on COVID and MS patients? Do you think that it's safe for MS patients to go out and do their normal course of life, with a lot when pandemic is out there? And we know that it's scary for some of the people,
Mm-hmm.
especially people who are on some of the treatments like Ocrevus, which
Mm-hmm.
actually reduces your immune system,
Mm-hmm.
so suppresses your immune system. So what is your take on MS patients and COVID? How do we deal with such a pandemic?
Yeah. Um, uh, MS hasn't, in terms of MS, it hasn't been proven that MS itself predisposes you to having a more or greater predisposition to become infected with COVID.
Right.
But certain MS medications can predispose you to having a more severe disease, like the Ocrevus, the B-cell therapies, Ocrevus, Kesimpta, rituximab,
Mm-hmm.
also alemtuzumab, and cladribine or Mavenclad. Those therapies may predispose you from having a more severe disease, especially patients that have other comorbidities like
Yeah.
advanced age, progressive forms of the disease, heart or pulmonary problems. Um, yeah, those patients can have increased risk from having more severe COVID infection.
Hmm.
Um, but I think that as long as you take the secondary prevention measures, like hand washing, keeping your distance, your masking, you should be safe. Avoiding overcrowded spaces. Patients in those treatments should take their special precautions, but that
Right.
shouldn't disinhibit them from interacting with other people.
Right. So, I would like to share my personal experience with COVID when I had in April 2021. I did not have any problem. My COVID was just fatigue, nothing else, no fever, nothing. I was just doing good. But after COVID, what happened that I started having episodes of spasticity, a lot of muscle spasm, a lot of cramps. I in fact had to take some medicines also because I do regularly exercise around 1 hour or 2 hours a day. I do exercise, so that was already taken care of. But
Uh-huh.
I was having these episodes. It was horrible.
Yeah.
Then my taste and my smell had anyways gone, and in fact it had altered, and this spasticity problem, and then I started having insomnia and a lot of fatigue. And in fact, these things lasted till after 8 to 9 months of COVID also. So I was quite amazed at why is this happening.
Yeah.
And doctors also could not believe or that after 9 months also I'm having so many symptoms which I did not have during the time of COVID positive.
Yeah.
So, like you said, that MS is different for everyone. I think COVID is also different for everyone. And
Yeah.
being MS patients, I think it's affecting people differently. So we don't know how it
Mhm.
is, what it is doing to our MS or
Yeah.
inside us.
Yeah.
So, yeah,
But
and in fact, after 9 months of those problems, I finally got my MS relapse on
mhm.
1st of January, I was taking my steroids drips, and I was, and the New Year time, I have been like on the bed taking the drips, and it was horrible. But the good part was that after that, I felt better, and all those problems that I was having in last 8 9 months after COVID, all those subsided a little. In fact, I started having a lot of hormonal imbalances also.
Wow.
Like I said, it's very common with COVID.
Yeah.
I just saw those things a lot in my case.
I'm
Just sharing my experience.
Yeah,
Yeah.
and that's a very important thing that what you mentioned in terms of that. As any other infection, COVID can reemerge your prior MS symptoms, and like the fever or even not having fever, just the infection can cause pseudo relapses, and
Absolutely.
yeah, depending on the severity, steroids may be indicated or not. That will be very
Mm,
particular for each patient.
of course, of course.
Mhm.
Um, so talking about this, I have two more questions here. This question is from Louis Ricciardo, and he's written, "What do you think the future is of MS? I'm newly diagnosed, but I keep hearing about how new these treatments are. I am on Ocrevus, and I'm hoping that I still live a somehow normal life throughout my entire life, and my symptoms are fairly mild and improved before my treatment." So,
That's a really, really good news. But yeah, I think that the future of MS is very promising. They're looking towards remyelination treatments. We don't have much data, but I'm really looking forward to hearing about that. That would be amazing. It would be amazing if we can revert MS therapies. I know that there are new trials that are emerging. We don't have enough data to support the use stem cell therapies, but new
right,
trials are emerging, and we are looking more into that to see if they're truly beneficial or not. So there are therapies emerging basically now every month. So I think that the future of MS is very promising. I think that every day we see that it's being more and more managed as a chronic disorder than a
yes,
terminal diagnosis. So
right.
yeah, I'm very excited towards what's coming ahead.
Talking about the treatments, I have a question from Nina here. She's written, which is a good medicine against MS at the moment? So, which medicines do you personally prescribe the most to the patients nowadays?
I cannot buy myself with one. I think that it will all depend on what other diseases do you have, what are your
Mm,
pregnancy or
right.
plans as well, your age of diagnosis. That will also help me determine which therapy or not. So I wouldn't buy myself towards one specific treatment. I think they all have their purpose and their role in each MS patient.
Yes.
Uh, so I think that would be my answer.
Um, Doctor, I have other question here about by Arsh, and she has written, "Doctor, I have too much of constipation problems, even take a lot of fiber, but my problem isn't resolving. Is there any remedy that you can recommend?"
Yeah, drinking a lot of water, doing exercise, um, fiber supplements, of course, stool softeners, also enemas, magnesium.
Hmm.
There you have just have to keep trying to see what's the most beneficial. But I will start with adequate water intake and high vegetable intake, and in addition to fiber supplementation. If that doesn't work, then you should talk with your neurologist to see if a stool softener is indicated or any other laxative agents when they're needed.
Right. Thank you, doctor. Um, so doctor, when you told about, drink a lot of water and have magnesium, talking about magnesium, which are the vitamins that you would recommend that we should be taking on daily basis, or should we be taking all any of the supplements on daily basis or not?
Yeah, vitamin D is a must for every MS patient. Vitamin D deficiency has been correlated with worse symptoms and disease outcome. So that's a must, and the quantity will vary from patient to patient depending on where your vitamin D levels are at. That's
Right.
the only one that everybody should take. Other supplements like magnesium or vitamin B12, they may aid, but there's no special data that
Mm.
recommends for MS patients to take on a daily basis, just as needed.
Right. Thank you. I have another question here by Wow Flutter, and she's written, does EMG effectively diagnose if spasm aren't present? I have had 72 hours straight, but what if they resolve before my appointment? So she has an appointment with the neurologist, I believe. So she's asking, does EMG effectively diagnose if spasms are present?
Yeah, they can. You can hear it actually when they're doing the study, and there's a spasm. You can hear the muscle firing constantly.
Wow,
So
really?
yeah, you can see it, and it can suggest that there's a spasm going on. So yeah.
Okay. I have another question from Tina. She's written, could be pain associated with MS? My neurologist says no, but I read that it could be connected. I feel pain all over my body when I'm tired, in my legs and hands. No other problems at all.
Uh, yeah, it could be. Why not? Depending on where your lesions are located, or if you have any neuropathic pains associated, they can be related to MS. Yeah,
Absolutely.
as
So yeah,
are feeling like super fatigued, that can cause tiredness and heaviness all over your body.
right.
Mhm.
Um, So, doctor, now I want to ask you that as a doctor, when you see the patients, what is your major concern when any MS patient comes to you first? What do you want to see or know from that person? And then prescribe the treatment accordingly.
Yeah, the first thing is to take a very detailed history from the patient, uh,
Mhm.
because to diagnose MS, there's specific what they call the McDonald criteria, and you have to comply with those. And the diagnosis is made from the clinical history from the patient, the physical exam findings, and the neuroimaging findings. So we need all those three uh, areas to be able to do a proper diagnosis. Once I have that information, and if the patient doesn't comply, for example, with the dissemination in time criteria, which is defined by having new lesions or multiple clinical events lasting more than 24 hours, or
Mhm.
contrast enhancing lesions in the MRI, then we can proceed to other testing like the lumbar puncture. If the lesions in the MRI aren't as typical for MS, then we start looking for the MS mimickers. So it's like a stage uh, that workup towards the diagnosis. But I think that the most important thing is to hear the patient, hear their history, and from there, then you can make the proper neuroimagings and the other evaluations.
All right. So, doctor, it's been 40 minutes that we have been talking. So I
Right?
too much of a time, probably your lunch time,
Sure.
and I really don't want to go hungry. So I'm going to take the last two questions. So one is a follow-up question from Wild Flutter, and she has written that, sorry, the question was, if spasms subside, so how do you diagnose with EMG?
You cannot see them if they're not actively, if you don't actively have a spasm, you cannot see it through the EMG. The EMG is not specifically for diagnosing spasm, but you can incidentally find them during the study.
All right.
Mm-hmm.
Thank you. The other question I'm taking is from Angie, MS Strength. She has written, what is your take on the link with mononucleosis, Epstein-Barr, and MS diagnosis. Both my sister and I have MS. Both my sister and I had head trauma and severe mononucleosis.
Yeah, so there are multiple theories on what causes MS. There is genetics. They have found that, especially in twins, the risk of them having MS is 25%. So there's a genetic component there. There's also families that a lot of them have MS, so and they have identified specific alleles within them, and they're studying more genes that may be related to the disease. There's also the ethnicity. They know that Caucasians are more that live far from the equator are more predisposed to having MS. Even if I live in Puerto Rico, if I moved to Alaska at an early age, I might acquire the geographical risk of MS. And if I move later in my life, I can pass that risk to my children. There's also the molecular mimicry theory that comes with the infectious etiology more commonly from viral diseases and more commonly from Epstein-Barr. They have found that having Epstein-Barr increases your risk from MS, especially during the childhood, 30 times more probable from having MS. The theory is that they might have some antigen that is similar to our myelin, and so our immune system and antibodies, they basically confused, and instead of attacking the antigen from the virus, they then attack our myelin instead, the central nervous system. So there are multiple theories going on. I think that MS is a multifactorial disease, and it varies with what we are um, exposed to and what our genetic predisposition is to the disease.
Okay, thank you, Doctor. Thank you for all your time. Just before going, if you don't mind, I can see there's a question by someone who is in the process of getting diagnosed, and I really don't want to, ignore this question as of now. I mean, this is something, this is a stage when people need help.
Mm-hmm.
So I think your guidance will be really important at this stage. Her name is Jenna Olent, and she has written, I had a MRI of my brain, and they found many lesions, which are enhanced as well.
Mm-hmm.
I am in the process of getting a diagnosis, but they said I meet the criteria. Do you have any advice for this process?
Yeah, I think that you're on the right track. You are already meeting the criteria now. Just trust your doctors. Read about the therapies. I think that the most important thing right now is to get yourself informed. Get to know about the disease. The more you know about it, the more empowered you are about your symptoms and what's going on in your body, and always make an informed decision, always by the hand of trustful resources and your doctors and communities like this that can guide you through the right path towards having hopefully a stable track from what you're suffering from.
Right. And I would like to add to this that, like Doctor said in the beginning of the session, that you have MS and MS doesn't have you.
Mm-hmm.
So be positive and stay strong. We all are together in this community and we are supporting each other. So always look out for positivity and surround yourself with positive people. There are 3-4 mantras that we always follow: a good diet, good sleep, good exercise, stay away from stress and negativity.
Mm-hmm.
So take care of yourself and just stay positive.
Yeah, just use MS as an excuse to start in a healthy lifestyle.
Yes, absolutely. Thank you so much, Doctor. It was not just a knowledgeable session, but it was also a very positive session today. And I'm so glad that, this was our first live session in 2022 after my MS relapse. And I invited you to be here, and you have really helped us answer so many questions. And this is what we want, a good guidance and good support from great doctors like you.
Yeah, I'm so grateful. I saw a comment here about exercise in MS. I know that I'm very sorry. But I know that uh,
If you want, we can go on. I'm still getting some questions. I'm just worried about
yeah,
you.
like varying degrees of disability. There are resources out there that can recommend you the best type of exercise for your degree of disability. There are thousands of options that you can take, and modifications from workouts and all different workouts that you can do depending on what works best for you. But always stay active. Please stay active.
Yes, so when I had my first or second relapse, I was doing a lot of physiotherapy, but probably that physiotherapy was also not helping me so much.
Yeah,
Then my doctor said, "Go and walk in the pool. That's the best you can
yeah,
do." And trust me, I just used to go to the swimming pool just to walk in the water and just to flap my hands up and down.
yeah,
That gave me so much recovery, which my 10 days of exercises at home could not help me, but that 2 3 days of my water walking did help.
yeah,
So,
definitely.
so keep exercising, keep moving, and you don't just have to maybe do weight exercises or yoga, or just choose whatever you like. You like aerobics, you like dancing, just do
Yeah,
what you want.
that works as well.
Absolutely. So just keep moving and do whatever you like. Just keep moving.
Yeah,
That's Thank you so much, Doctor. It was so lovely having you here. And
uh,
we can do this session again sometime when you are
yeah, of
free.
course.
Love talking to you.
Any more than up to it.
Thank you so much for your kindness and all advices today. You have a wonderful day, and we all are with you whenever you require anything from us. Our MS community is always here supporting you in every way.
I'm here for you guys too.
Thank you, doctors. And everybody here, please follow Dr. Molina. She is on Instagram. Go to her profile right now, and I'll be anyway sharing her profile again on our page. So you can go and follow her and ask her questions, whatever whenever you want to get in touch with her. Thank you so much, doctor. You
Thank
have a good day ahead.
Bye.
Thank you. Bye bye. Thank you. Thank you everyone for joining us today. It was a wonderful session, and Dr. Molina has been really kind and really helpful. I could see we have, yes, skipped a few questions, but do keep in touch, and you can message us or DM us your questions that you have and we want to answer to that, and we are always here to answer your questions. And once again, thank you everyone for all your support. And today it's such a great day that not only did we do the first session, live Instagram session in 2022, we also have 20,000 plus supporters today. Yippee! That's because of all your support and love. Thank you, everyone, for all your support. And we love you all. And we'll be coming back again with more such live sessions and more a 10 Minutes for MS podcast. Thank you so much. Have a good day and good night to Sam. Bye.